Welcome back to the Caribou Data Science channel. Today is Wednesday, November 18th. I'm getting ready for my daily report for the U.S. So let's go and fire this up and see exactly what's going on here. Lots of talk about the virus possibly being available by January 1st. This remains to be seen, of course. So currently, the U.S. is averaging 37,491 cases per day and 938 deaths per day. You can see the average mortality rate here is under. This is 5. So this is about 4% or 3.2% here. And you can see, look at all the days when the mortality rate is less than average. No surprise here, cases spiking upward. Okay. Deaths also spiking upward towards the 1500 line here. The volatility has actually passed this line, but the average is remaining low. Zoom in on cases, no surprises. Zoom in on deaths, you get a little better picture of what's above this. So this is 1,000, this is 1,500, so this must be 1,250. So you see that the average is now crossed the 1,250 deaths per day range, plus some massive spikes up here. Look at cases. The cases, of course, this problem is right here. Cases are continuing to spike upwards. Although there's a chance that, well, this number may not catch this one here. Look at the average number of deaths per week. Lots of weeks under, although last week spiked above it. But hopefully the average is going to keep it down here. Cases by month. 1, 2, 3. See, November's cases has already passed October's and even July's cases. Deaths are close to going 20,000 for the month so far. There's a really good chance, unfortunately, that it'll pass this number right here before it's over with. Okay, so that takes care of the report for the U.S. for today. So let's just go ahead and run this report from the top then. So we can now move this up, update this one. Okay, there we go. So that takes care of the U.S. Now let's come back to the top. Let's take a look at the Camino. Let's take a look at Spain. Okay. So let's just take a look and see if there's any Spanish Spain COVID-19 news. Okay, Spain's other COVID-19 COVID casualties, undetected cancer cases. Italy and Spain report the highest daily COVID-19 deaths of the second wave. Okay. Spain's General Medical Council calls for COVID health to be fired. That sounds vaguely familiar to me. Okay. So let's go and see exactly what these people are squawking about today with these numbers here. I honestly don't remember. For some reason, I don't remember this actually being a second wave, but we'll see. Number of cases. Let's see something here. 4,674 cases per day, 129 deaths per day. Take a look at the mortality. You can see that the mortality rate's a little under 1%, but the numbers are continuing to climb above that. It's above 2% now. Once again, the problem with Spain is this number right here. Okay? I'm almost tempted to not even plot these numbers here anymore. This is so bad. But you can see here that this is This is the 17th, so this was yesterday. You had 13,159 cases yesterday. This number here is 25,179, and this is 38,000, which of course was Monday, which included Saturday, and Sunday numbers also. So what's the real? I'm going to go with this number right here: 25,874 cases per day. Look at deaths. No surprise here again. Once again, we got the dates, so that's kind of. So let's just say that the 422 deaths per day right now. Okay, come down to here. This doesn't really help. I'm not sure why they're calling it a second wave. To me, this is just one continuous wave. Okay, I don't really see a wave there like that. Let's just do something a little crazy here, shall we? Let's. What happens if we get rid of this right here? Okay, that's exactly what I'm going to do here. They're going to sit there and mess around with their numbers. Okay, if they're going to sit there and mess around with their numbers, they're not going to get rid of the daily numbers and go for the. Okay, so let's get rid of that. We're simply going to start doing smoothing numbers now. Okay, get rid of this. Get rid of this. Okay, so let's try this one more time. So basically, I just commented out the daily line, the daily numbers because of this volatility, and we're just going to go with the LOVA, with the LOAS function to give us an idea of what's really going on a daily basis. So you can see the daily mortality rate above 2%. Well, let's see something. So let's put this. Let's just do this. See what happens here. Okay, so we don't want the points. All we want is just the LOAS line. Okay, that's all we want. Get rid of points. Okay, so let's plot daily cases. Let's plot this again. So you can see cases are spiking here. Deaths fell, then begin to rise again. Cases by dates since June 1st, climbing up above 20,000. And once again, you can see the deaths up here at 150 per day. Calculate the non-moving average, calculate the weekly numbers, plot the 2 weeks. Okay, I guess they're calling this the second wave. It's pretty leveled off at about, what, about 65,000 here for a few weeks. Then now this week we had this huge spike and the week's only half over with. But on the other hand, the deaths are only about 1,000 per week. Okay, monthly numbers. Sure, you can see that that we had actually October will certainly catch September's cases, and October will certainly pass September's deaths. So that's it for Spain for today. It's really annoying that they keep doing this thing without without with the Saturday and Sunday numbers. It's really just messes up things up. So instead, I'm simply plotting the smooth curve. Okay, the smooth average, which is currently about 25,874 for cases, and about 460 for deaths per day. Okay, nothing new here. This is just the cases starting for June. See a little jump up here. I'm not sure if this is the second wave or this second wave, but anyway, cases again, deaths again, cases and deaths. Okay, so this takes care of the report for Spain for November 18th. And we'll move on to Israel here in just one moment. This, okay. Let's come back over here. Let's take a look at Israel 19 news. Okay. With two possible COVID-19 vaccines in the forefront, well, Israel rushed to get shots. I don't know. COVID-19 live. Netanyahu says has agreed with the Moderna on the greater vaccine supply. Most Israelis afraid to be the first to receive COVID-19. Israel army to stop monitoring social media and fight against COVID-19. Well, that's interesting. Israel eases new set of COVID-19 restrictions. This could be kind of interesting. Let's see. Israel coronavirus. Israel's coronavirus cabinet decided on Monday to lift certain restrictions on the public as part of a gradual reopening of the economy following the weeks of full and partial shutdowns. The cabinet rules that students in 5th to 6th grade will return to school on the 24th, and those in 11th and 12th can return on December 1st. According to the report, ministers also revealed a pilot program to reopen large stores and shopping malls in areas with low COVID-19 infection rates. Okay. Well, no, honestly, as you'll see here in a moment, Israel's numbers have been looking really good. Okay. Except this is Spain. Israel's numbers have been looking very good. Okay. Now, of course, the risk, of course, is, as I've said before many, many times, shutdowns are band-aids at best. They don't really get rid of the disease. And as long as the disease is still in the wild, the moment you open back up, the cases are going to go back up and deaths will eventually follow. So Israel is only averaging 1,015 cases per day and only about 9 deaths. And it was a mortality rate of 1.2%. Okay, this is good. This is 1.2%. You can see here that the mortality rate has been falling since late October, early November. It's now below at 1.2%. If we look at cases, you can see there was this long declining cases beginning the end of November, fell down to here. Now it's starting to trend up maybe a little bit. Let's take a look at deaths. The deaths are continuing to decline down internationally. So this is very good news. And this is 10 deaths. So this is maybe five deaths per day, which is about average, what they say. Zoom in a little bit to June. You can see this may be trending up just a little bit, but they had a really good long downward run. Deaths continue to fall. Cases have been falling since 6 weeks now. Remains to be seen if we can make it 7 weeks of declining cases. Uh, deaths have been falling for 4 weeks now. Looks like there's a good chance that this week will not have, deaths will be below this number here. Now you can see here October's deaths were below September's. And there's a chance November's may not catch October's death cases either. There's a really good chance that November's cases won't even catch September's deaths at this point. So the news continues to be good for Israel. Okay. So we'll wrap this report up, then we move on to Pakistan, I believe. So let's take a look at Pakistan's COVID-19 data now. Okay. Okay. COVID-19 insecurity slows Afghan refugee returns from Pakistan and Iran. England to tour COVID-19 in Pakistan, WHO fighting tirelessly against the odds. Yeah, but except for the fact that the numbers are really are increasing. Okay, are not. Okay, here you go. So far, Pakistan has fared well in the fight with COVID-19. In a country with over 212 million inhabitants, to date, roughly 303,000 cases have been recorded, and the curve now, and the curve of the new infections has flattened its peak in May and June. Okay, deaths. There we go. So now let's come back over here. Let's take a look at Pakistan. Okay, let's take a look at Pakistan's numbers now. Okay, now. So currently, Pakistan's averaging 1,139 cases per day, but only about 23 deaths. Now, unfortunately, you can see the UR had a really large spike back up over 2,000 deaths for yesterday. Deaths are climbing back up over. Well, this is 25, about 30 deaths yesterday. Zoom in, zoom in. You can see here that follow a very long decline in cases and now having a spike. Excuse me, we had a 1, 2, 3, 4, 5 week increase in cases. This number could catch this one here, remains to be seen. Deaths are still relatively low, with a spike here of above 125. So deaths are very much better than cases. Uh, October cases have passed, or November cases have passed October cases, and November cases have passed October, or November deaths have passed October deaths. So it's so it looks like there is a new trend, a new spike in cases and death in Pakistan. Hopefully they'll get that under control. Okay. So that takes care of Pakistan's report for today. So that concludes the reports for the my daily reports for the nations. I hope this you found this helpful to you, and we'll catch you on the next report.